It broke the record actually at the airport for most snow on this date by 4 a.m. So, I mean, that just shows you how that lake snow band has shifted into the city, and it presents all kinds of problems. We have Dr. Michael Mangione from Mercy Hospital joining us this morning to talk about some of the issues they're facing. And we're hearing a lot of stories, Doctor. I mean, one in particular that expectant mothers are being brought in on snowmobiles. Can you verify some of these things and some of the challenges you're facing?
Yes, thanks for having me. You know, the snow has definitely been an issue with EMS trying to get into the facilities. They're having a battle going around stranded cars, snowbanks, getting through snowbanks, having issues trying to even get to people in their homes that are needing help. So it's definitely been you know, a lot of people reaching out for help, and a challenge to get to those people to bring them to the hospital to get the treatment and care that they need.
Right. It's one thing for us to say, stay home, it's the weekend, but under emergency situations when people need to get out of their homes and get to a hospital, in many cases they can't because A, they're either snowed into their homes, or B, the streets are blocked because of stranded drivers and they can't get to the hospital. Then when they do get there, their situation might be worsened because it's taken so long to get to the hospital. So is your staff seeing more difficult cases because of the time that it's taken folks to get to the hospital?
We've seen, I think the most major issue that we've seen is more related to like cardiac issues. We've seen people that are, you know, outside shoveling, snowblowing, having chest pain, shortness of breath, dizziness, and then being found down for an unknown time in the snow. And then EMS getting there, having to start CPR. So that unknown downtime and that time that is for these people to get to them, it puts them at risk for, you know, having their life end because of not seeking or getting the medical treatment that they need.
And what about your doctors and nurses and staff there just getting themselves to work?
Yeah, we've put in contingency plans at the hospital. On Wednesday, we prepared both the staff, the physicians, physician assistants and staff, and prepare them that they might need to stay for longer shifts because of the other staff not able to get in, or them not be able to get out. And this happened at the Mercy Ambulatory Care Center in Orchard Park just because of the amount of snow that they had. Both the doctor and the nursing staffs there had to stay overnight. And we prepared giving them food, making sure that they were fully prepared in case that they needed to stay over. And in fact, that did have to happen last night.
Yeah, Doctor, as we say, this isn't our first rodeo. When you see snowstorms approaching like this, what are some of the things that you prepare for from an emergency room perspective? Because we know there are the initial onslaught of cardiac cases like that, but in the aftermath, when more people get out, are there snowmobile accidents? Are there snowblower accidents? What are some of the things that you prepare for?
Right. So usually we see a lot of people having falls. I think last year when we had that big ice storm, we saw an increase of like 60 patients that we were used to seeing in a day, just related to fall injuries. They slip on the ice, you know, hit their head, broken bones. You know, on top of that, it's cold and flu season, so we're seeing a lot of respiratory issues just because we're seeing a lot of influenza A, COVID still around, and this uptick in RSV for the pediatric cases. So we do our best to increase staff and prepare for the influx of patients that we are going to see, knowing that once the snow clears and the roads clears, you know, people are going to seek some medical attention. And we all know that there's probably been a couple of day delay of getting the care that they need, that they could have their issues, you know, worsened because of that delay in receiving treatment.
And what are some of the signs and symptoms that folks should look for possible cardiac issues when they are shoveling? Unfortunately, we do know that the county has reported 2 deaths so far related to cardiac arrest because of shoveling. So what should folks look out for?
So if you are shoveling, especially the heavier snow, if you start experiencing any left-sided chest pain going down your left arm up into the jaw, feeling nauseous, sweaty, feeling like you're going to pass out, shortness of breath, you know, if you start having any of those symptoms, definitely stop and call 911. Those are the early warning signs of a possible heart attack or an imminent heart attack.
And doctor, I know a lot of people, with an event like this, may be hesitant to go to the emergency room, whereas that would have been their first stop in the past. What's your advice to them? Should there be any delay whatsoever in requesting emergency help?
No, I think it's life, and it's your life, and it's extremely important. And that's how we look at it. If you feel like you're having a life-threatening or an emergent condition, call 911 or try to get to the hospital. That's what we're here for. That's our jobs, and we want to take care of you and help you.
All right, Dr. Michael Mangione from Mercy Hospital and Catholic Health, thank you so much for joining us this morning. A very busy man in Mercy Hospital, so we appreciate the time that you're taking to be with us and giving our viewers some advice when it comes to shoveling and staying safe and staying healthy, and also having to deal with all of those issues related to getting to the hospital.
Yeah, for sure. They've got their hands full, no doubt.